planted under the skin. And those are some examples of estradiol. You know, topical cream, that's a Vivel dot, probably 0.05 middle of the road patch. Those are estradiol pellets in that person's hand, and even conventional medications like Vagifem is bioidentical estradiol. So there are actually a lot of bioidentical hormones that are patent pharmaceuticals. The patch is a patent pharmaceutical. It is bioidentical estradiol. Vagifem is bioidentical estradiol. So estradiol eliminates hot flashes and night sweats, improves sleep, enhances mood, mental clarity and memory, builds bone, maintains youthful skin, reverses vaginal dryness, can help with hormonal associated migraines, prevents hair loss, especially that crown of the head, promotes cardiovascular health, and actually has been shown to slow telomere shortening. So progesterone, lots of options for progesterone. You'll see topical progesterone over the counter. Sometimes I see women coming in who are bathing in progesterone because they can get it over the counter and they're desperate and they think it helps, and long term it can actually cause low estrogen symptoms to get worse. Compounded medications, I forgot I found that. Female compounding pharmacist. Calms the brain, protects the breast from estrogen. A woman on estrogen, of course, protects the uterus. But this is something I wrote about in my book, the Goldilocks principle, which means not too much, not too little, just the right amount. So if the symptoms of estrogen imbalance don't resolve with progesterone supplementation, it's because a woman needs estrogen and testosterone. And you cannot give progesterone and have it convert into other hormones, just like the expectation is, well, we'll give DHEA and that will fix all your hormone problems. It doesn't work like that. That's like saying, well, we'll give you cholesterol and you'll just make what you need. The body doesn't work like that. What you see oftentimes is side effects, but you haven't fixed the underlying problem. So if there's a hormone deficiency, the patient needs that hormone. So testosterone supplementation, what can it do? Well, you'll notice the lists for women and men are the same. Enhanced libido, cardiovascular protection, energy and vitality, decreasing fat deposition and increasing muscle mass, and then the brain benefits. And men need it for normal erectile function. So I don't know if you can read that. Doc, can you write me a prescription for some of that Viagra? And she's saying, say no. Because nobody gave her testosterone, right? You also need testosterone, women, for normal blood flow to the clitoris. So sometimes you'll hear your patients talk about the fact that they can't have orgasms anymore. And that can be from low testosterone. These are some options for testosterone replacement. Again, topical creams or gels, troches which go through the buccal mucosa. I don't use those a whole lot because you end up swallowing a lot of that testosterone. Pellets, the striant buccal patch, which is interesting, the Italians invented that, that just sticks on the gum. And then injections, which can be done daily or weekly. And if you'd like more information, here are some resources for you. So my website, there's a section called resources, and then there are a ton of handouts on bioidentical hormone replacement research. One of them is 144 pages of abstracts that I've summarized, or studies that have been summarized, and they're hyperlinked. So if your patient says, my doctor says this, you can go there and fairly easily find studies on that topic. Hormonebalance.org is Dr. Glazer's website. She's a breast cancer surgeon in Ohio who is a genius and probably doing more than anybody on the planet to further testosterone research and use in clinical practice for women. And then womeninbalance.org, which is a nonprofit organization. So, makes sense to test, treat all the causes of hormone imbalance, and educate your patient. And we're running out of time, but this is actually where you guys come in. Okay. The 8 steps to achieving hormone synergy. These are the 8 steps that I came up with in my book, and I thought it may actually be valuable just to highlight a couple of them, which I think is what your guys' expertise can really help patients with. And you notice the 8th step is hormone replacement. So the first 7 steps are functional medicine. And the first step is to reduce stress, helping them empty their stress bucket and understand the ramifications if they don't. A lot of people are addicted to their stress. Their story is they need it. They need to be that stressed out. So educating them about what the stress is actually doing to their bodies and the fact that they're aging because of their stress. They are in real time shortening their telomeres. So they are rapidly aging their body. And then another thing that you can help them with is what I call, there's 2 panaceas in medicine, and one of them is exercise. So I know that you're probably as challenged as I am in practice with getting patients to do this. Because here's some alarming statistics. 40% of Americans are totally sedentary. 40% of Americans have cardiovascular disease. That's interesting. Less than 20% are active enough for blood vessel and heart health, and 50% drop out within 6 months of starting a program. Because a body at rest stays at rest. It's really hard to keep going. But it is the #1 anti-aging remedy available. And getting your patients to do it every 24 to 48 hours is crucial. Because exercise obviously has a lot of benefits. Anybody remember the $6 Million Man? Remember those dolls? They're the $6 Million Man dolls. Maybe the biggest benefit of exercise, Daniel Amen writes about this, is that people who exercise actually have better sex. So maybe that would be an incentive for them. They have more active sex lives, better orgasms. But this is America, so somebody published the alternative book, I'd Rather Eat Chocolate, Learning to Love My Low Libido. So that's an option too. So step 5 and 6, another area where chiropractors are exceptional at helping patients with functional medicine, getting them to do a detox. How many of you do detoxification in your practice? Excellent. Very important getting patients to do a detox and eat healthier and lose weight. Because it's not a matter of if you're toxic anymore. We all live downstream. We all live in this garbage can. So it's a matter of doing something about it. And when it comes to obesity, by the end of this year, 3/4 of Americans will be clinically overweight or obese. I know, it's an epidemic. There's obviously many factors associated with obesity, so this is not simplistic. And a lot of people say, well, I'm just getting older, so I gain weight. So let's look at that. Is it common to gain weight with aging? Yes, it is. About 30 pounds between the ages of 25 and 55. But let's look at what that means. 30 pounds in 30 years, there's 3,500 calories in a pound, roughly. 3,500 extra calories per year to gain that pound. That's 10 calories a day or less, which is 2 M&Ms, 1 Lifesaver, or a half a Hershey's Kiss. So, this business that it doesn't matter what I do, I can't lose weight. Yes, it does. It's about every single thing that goes in your mouth, right? And your activity level. And teaching patients, if you eat 2 extra M&Ms a day, you will gain a pound a year. So being really accountable. These are just some fun slides. Not really fun, they're depressing as hell, but I thought they were fun to put together. So these are from the CDC. And this is a map of obesity in the United States starting in 1985. And you'll notice the kind of the darker blue, 10 to 14% of adults in that state are obese. So BMI over 30. So watch what happens. This is 1986, 87, 88, 89, 90, 91. Now we have a new variable. The states that are dark blue, 15 to 19% of adults are obese in those states. And the medium blue, it's still 10 to 14%. So this is 1991, 92, 93, 94, 95, 96, 97. We have a new variable in 1997. More than 20% of the tan-colored states population in adults are obese, 15 to 19% in the dark blue. Watch what happens here. So this is 1997, 98, 99, 2000, 2001. We have a new variable, 25% in the orange states. So the tan and the orange. 2002, 2003, 2004, 2005. Aha! We have another variable. In the red states, more than 30% of the population is actually obese. 2006, 2007, 2008, 2009. And this was in 2010. So this is the last, they just updated this, so I have the new data. So in 2010, the red states, more than 30% of that population is obese. 25 to 29% in the orange states. The tan states are 20 to 24%. Notice that no state has less than 20% of its adult population as clinically obese. And then they changed the colors at the CDC. I don't know why they did that. So now the red states are more than 35, orange 30 to 35, and the yellow is 25 to 30. So here's where we are now. How many of you have weight loss programs, detoxification in your practices of some sort? Education, nutrition, excellent. This is the global epidemic. This is part of the main reason that we have so many problems with hormone imbalance. And of course, it's also related to toxicity, in my opinion. So what can you do? There are so many things you can do. And of course, there are many factors. So individualizing your programs is helpful. But having some sort of program for patients is critical to help with weight loss. We're going to skip through the supplements because you all are specialists in supplements. Probably going to highlight the most important supplement, I think, for hormone balance, which is vitamin D and fish oil. So you can read through those. And adrenal support, bone support, obviously vitamin D. Actually, a study looking at vitamin D and telomere length in identical twins, which is of interest to me because I'm an identical twin. I've tested my own telomeres. I haven't tested my sister's, but the twin with the higher vitamin D levels had longer telomeres. So those are just, this is all information on supplements, which you can read if you're bored sometime. Okay. So your patients have a choice, basically, on how they age. They can go the conventional route, or they can do what it takes and really focus on treating the cause and preventing that. This is my favorite Randy Glassbergen cartoon. Each capsule contains your medication plus a treatment for each of its side effects.